the phone, the fridge, the internet, the leaf rake. Who would have guessed a leaf rake would be the Rosetta Stone to understanding back and body pain? You know, science is reproducible, and if you didn't know, there is no science to our current understanding of back and body pain. Outside of fracture, infection, cancer, or other exotic disease, there is no correlation between the hard evidence of X-ray and MRI with back and body pain. There is none. You know, that's what we do. We analyze and we observe, but we know the facts, they don't add up. You know, but you don't know that. And we're stuck analyzing, and so when I was in school, I was made aware of disc theory. There's no science to disc theory, right? It can herniate to the left, pain goes down the right leg, right? And I was made aware of the flaws when I was in school, but hey, again, I'm a student, I'm trying to fit in. So you literally forget what doesn't make sense, and we preach these worn out things like there's science when they're not. And it's like the earth being flat. You've been convinced, and I'm in line with the greatest minds in the country, right? So what you're witnessing is just the evolution of our understanding, right? You know, a doctor once wrote that on the first day of medical school, they were told that fully half of what they were about to learn would turn out to be wrong in the end. They just know which half it would be. Well, part of that half is the part regarding back and body pain of musculoskeletal origin, right? You know, it makes no sense. And the leaf rake is to, you know, back pain what DNA is to solving crime. It makes sense of what we observe. So, for example, I had a gentleman, 82 years old, pain in the right hip. On X-ray, the other hip's more arthritic, right? But when cortisone and PT don't do the trick, they want to do hip replacement for what? For quote bone-on-bone arthritis. When on X-ray, the other hip's more arthritic. So these are the things when they don't make sense, but you just I don't know. Who knows? Nobody has anything better to replace it with. I didn't, right? Until I came across the leaf rake, because I couldn't fix those cases until I came across a precise leaf rake approach to treating muscles. Because typical muscle therapies do either finger painting or mashing and compressing the soil. The leaf rake tills it, right? And the confusing aspect is there's a moment when the compression can feel miraculous. That's the thing. The confusing aspect of back and body pain is so many things can feel miraculous most of the time, right? And but compression, it doesn't work on tough chronic case. Everything works till it doesn't. This is what works when nothing works. And the worst part about it is work. It's not magic, right? Sometimes you're gonna feel like you're digging the Panama Canal with your hands, right? It needs to be automated, right? For the same reason we have harvesters and chainsaws. We need labor-saving devices. And when that happens, the leaf rake will decimate the field of disc and joint surgery, put a lot of people out of work. So this is better science, and if you're interested in deeper truth and better science, I invite my colleagues in the field of spine medicine. The leaf rake elicits the very thing we look for in examination tests like discography, which is to hear the patient say, "That's it, that's my problem." That's the very, doctors look for that in examination. They don't find it, right? And we're so used to not finding it, we almost forget about it, right? But when you say, that's it, that's it. It's in the muscles, we just haven't been treating them correctly, right? And again, the worst part about it, it's work, it's not magic. So if you have a friend, a loved one, anyone willing to do the work, you need no prior experience or background in anatomy. All you need are some bony landmarks and a leaf rake, right? So what you're witnessing is just the evolution of our understanding. And there are so many people out there suffering chronic pain, and more than anything, what you need is someone willing to do the work. And again, there's nothing magic about it, but if you do the work, the relief your body's been aching for awaits.